So the patient who changed me as a nurse forever. There is one patient that I still think about almost every day. I can tell you about the story, but of course, you know Heber. I can't tell you the name. So the story goes like this. So I was doing my routine home visit. Vitals here, medication here, safety check here, the whole 9 yard. But something about this visit has always stayed with me. So the patient looked at me and said something that I didn't expect. It was not about their illness, not about their pain. And this is how it went. Thank you for seeing me, not just my diagnosis. And I realized something in that moment, that sometimes patients aren't just waiting for treatment. They're waiting for somebody to acknowledge that they're there. They're waiting to feel as a human again. The patient reminded me that nursing is just not only about medication, about wound care, about vitals. It's all about the presence. Back in nursing school, they teach us treat the patient as a whole, right? And since that day, I tried to slow down. I really tried to see the person sitting in front of me or laying in front of me. I do ask them about their day. I'm not just there to chart, right? Let's have a conversation. The patient probably has no idea about what they did to me, but they changed the way I am a nurse forever. Okay? And if you're a nurse, you know that there's always one patient you never forget. This patient made me switch my strategy when I'm visiting a patient. I'll ask them about themselves, how the day is going. Of course, we'll do the physical assessment about them and about the diagnosis that they have. But also, I want to hear their stories. I want to hear their good days. I want to know what they did. Knowing what somebody did in life does help you guide them in the right way. For example, you have a patient who says, I barely sleep. But they tell you they've been waking up, or they did wake up for over 40, 30 years at 5 a.m. to go to work. There's that routine. Their body has been fixated on waking up at 5 a.m. It will be difficult for this patient to sleep in until 7 o'clock, right? I had a patient once who told me that, are you wearing a certain kind of perfume? And I said, yes. How did you know that? This patient was blind. I didn't know that this patient was actually a scent person. Like what he did for a profession, he created scents for this big perfume companies, right? And that triggered my mind. He told me about different perfumes. He told me how he would know the scent was this and this. And that's where you sit down and you rethink, right? Think about this patient as a whole. Treat them right. Treat them